This is going to be a two-part series on releasing the psoas. We're going to be doing that in this first part from kind of its lower portions around the ASIS down. We're going to stay where it inserts is to the lesser trochanter. We can kind of get to it, kind of not, but we're going to stay in this upper third of the thighs. So we're going to be focusing from the ASIS to the upper third of the thighs. We're going to be using a Corgis ball or some type of air-filled ball and 2 sets of toted balls. If you don't have 2 sets of toted balls, then you can just simply use 2 individual balls. It'll just be a little bit more intense. And in the next part, we're going to focus on the psoas basically from the ASIS up to the lower ribs. The psoas comes from T12 or L1 down to L5 and then to the lesser trochanter. We're going to be hitting a lot of other things along the way, especially its kind of partner in crime, the iliacus. We're going to be addressing the quads, the abdomen, the abdominal wall. So follow along. We are going to start by assessing laying on our back. We can do this in a lot of different ways. You could assess standing, you could assess a plank. If you know that your psoas is tight, you can do a move that you know is usually something that is an issue or bothers you. Otherwise, just start by laying on your back with your knees bent and your feet flat. And check in with how your pelvis is just naturally resting. Along with that, check in with how your lumbar spine is naturally resting. Finally, checking in with how the rib cage, especially the lower ribs, are resting. So right now, just where is your body, where is your skeleton settling? Without changing, without holding, without adapting, just where are you? Similarly, how do you feel across the front of the hips? Are you very tense and ropey? You could use your hands to check in. You could just feel this from the inside. And then see how it feels. You might use your hands again. You could either put a hand under the low back, you could put a hand on the abdomen or on the front of the pelvis. You're going to see how it feels to slide one leg out straight and bring it back in. And just notice if you can do that. Can you move your thigh independent of your pelvis and your low back? So for many of us, when we straighten our leg, our pelvis tips forward and our low back arches further. Similarly, when we come back in, we sometimes then tuck the pelvis and round the back. For right now, we want to see how independent can the femur, can the thigh move from the pelvis. Do that on both sides. And there might be some engagement, but maybe just noticing how much engagement do you need or how hard is this to control. Ideally, we want to be able to do this since we stand on 2 feet upright most of the time. This should be a natural thing for us, but in many of us, our psoas or this anterior hip is quite restricted and tight. So that's the assessment, just how does it feel? And then we're going to come in and we're going to do all of these, many of these rolls are from Jill Miller and the role model method. So this is called Quad Quest. Where we're going to be going is, again, focusing on the upper third of the thigh, going from this upper third up to the ASIS. The ASIS is, we have 1 on each side at the front of the pelvis where those bony outcroppings are. In this area, we have the inguinal ligament and the inguinal kind of crease. In here is where our lymphatic vessels and lymph nodes, femoral artery, vein, and nerve are. So we want to avoid directly there. As we move up, we're going to start to move out kind of to where the pocket of our hips are. So 2 toted balls or 1 individual ball on each side at that front top third. Laying down onto the balls and adjusting as you need. And you're going to start with laying prone. You can be on forearms, which will decrease the pressure, though it might increase some discomfort in the low back. Or you can be on hands. And start by waggling from side to side. Just an easy rock. If you need to adjust the balls in any way, you can use your hands, you can kind of pull your body, do whatever you need. If you want to even just do a little bit of a quest here and go up and down, you can do that. Then what we're going to do is see how it feels to pin and stretch. So what this will be is bend one knee and straighten. Switching sides. You can also do both together. We're often a little different from side to side, and as you do this, ideally, you'd have awareness that your pelvis is still. We are trying to pin and stretch, and the only way that we're going to stretch this area is if our pelvis stays still. If our pelvis tips forward, then we're no longer stretching, we're just moving the body, right? So instead we want to try to create this glide and slide, this lengthening and shortening, kind of a stretch and recoil. And then you're going to keep either one leg bent or both together and windshield wiper the leg in and out. Again, this is the thigh moving, the femur rotating internally and externally, and not the pelvis. So I'm not doing that waggle I was doing before. Instead, I'm just rotating the thigh. Do the other side. If you're doing both together, just continue. And then we'll do the same thing. We'll just move the balls up about the width of the balls. If you're getting close to that inguinal crease, move the ball out a little bit to the side. And same thing, waggle, pin and stretch. You can always pause the video and do each of these for longer if you need to. And windshield wiper. I prefer to do all of these one leg at a time. It's just a little less distracting. Switching sides as we windshield wiper. And it helps me feel the nuances. I'm definitely asymmetric here. We'll do one more spot. As we get up to this higher spot, again, if you're really at that inguinal crease, you can bring it so that you're just kind of on one ball. And we're getting closer to the ASIS now. So now as you waggle, you'll find that outer ball, right? So your waggle might even get a little bit bigger. The other option here is to turn the balls from horizontal to vertical, and that might work better for you. So we all have a different structure, different anatomy. Things have to move and shift. Again, we waggle, we pin and stretch. And so we're addressing the quads here. We're also addressing a muscle at the top called the TFL, and then another long muscle called the sartorius, all of which have some attachment to this very superior thigh and anterior pelvis, ASIS and AIIS even. And then again, a windshield wiper. From here, we're going to take just one ball. I may not have said we needed a block, but we're also going to use a block here. So one ball and one block. This is called high inner thigh. We're going to come up to the inner thigh. So we're going to work through the adductors and the inner thigh a little bit. Where we're trying to get is where the psoas attaches, and the iliacus as well, into the lesser trochanter. We're not going to directly press on it, but we're going to get as close as we can. So we're going to be really high, and then we're going to be going in a direction towards the outside of our hip. So I like the block at its medium setting. You can turn it as you go. You're going to come up and over onto the ball, and then you're creating this direction of the ball pushing up and maybe towards your hip as well. Now this might also be really sensitive and tender. I've gone directly onto a really nice tight spot. So I'm going to breathe a little bit, take some time to arrive. And I'm kind of wanting to go down, but I'm going to stay up on my forearms and breathe. Seeing if these tissues can soften and start to release. You might see that my knee is starting to drop. You might feel that your knee is starting to drop, or that something is softening and releasing, so we're able to snuggle in a little bit more. And as that happens, as the knee starts to drop, that pressure is going to be directed, again, up to the outside of the thigh, but also towards the pelvis. Continue allowing that. And even if nothing is releasing, you can just stay and breathe. We're not going to do a lot of movement. We're not releasing the inner thighs right now. We're just trying to get to that deeper part of the inside of the femur, the lesser trochanter. It's deep, deep within. And so even if this doesn't fully release, you're letting go of some tension, and just breathe and hold. If things are really uncomfortable and really rigid, what you can try is a little contract, relax. So you can try to squeeze the knee towards the ground and even push the foot into the ground. You'll feel these muscles contract, and then relax, let it go. Contract, maybe for about 3 to 5 seconds at 30 to 40% effort. You're not gritting your teeth as hard as you can, and then relax, let it go. Soften and breathe. You can do that a couple of times. And we'll just do that pretty briefly, and then we'll switch sides. Again, any point that you need more, you need longer, hit pause or come back to it. And as I do this, I'm trying to get that ball pretty darn close to my pelvis. I'm not right at my pubic bone, but I'm pretty close to it. And you can, again, search around a little bit in here first, and then see if you can start to soften. If it feels better for you to go all the way down, you can. For me, that's just too intense, so I'm staying on forearms. And again, we're just trying to let this ball snuggle its way in, moving up towards the outer thigh, and then towards the pelvis on kind of this diagonal line. Closing my eyes is always helpful. Do what you need to go to your kind of happy place. And maybe as you just simply hold here and breathe, you feel these tissues softening. You might feel the knee dropping. The nice thing is feeling that release, and then sometimes the not so nice thing is feeling that it gets more intense. If, again, nothing is letting go and you're just kind of holding here and things are really being kind of persistent, you can do a contract, relax. You can contract your knee towards the ground, pushing down through your foot, and then letting go. A 3 to 5 second hold at maybe 30 to 40% effort, and then 100% relaxation, as much as you can. You can do that as many times as you need to start to release. And again, just breathe easy. And again, we'll come off of that. You might find that you need more time. You can do that if you need. Now we're going to use the Coregeous ball to do something similar to what we just did in that quad clasp. We're going to be in the same area, but maybe a little bit higher, maybe right at ASIS, and coming in to really truly more where the iliacus and that iliopsoas, the common tendon or musculotendinous junction, kind of comes across the front of the pelvis. So for this, I tend to put the ball kind of on my top hip, and then I roll onto it. And from here, instead of waggling, we're just going to move. We're just going to rock from side to side and just check in. Check in with how it all feels. If a shirt is getting in the way, you can move it. This is a soft ball, and so now we can be aware of that inguinal line from ASIS to pubic bone, where our inguinal ligament is, and again, these more sensitive structures. If anything feels pulsing, throbbing, sharp pain, tingling, numbness, back off. You don't want to be pushing onto those things that are giving that response. Once you're ready, you're going to pin and stretch again. You're going to check in to make sure that this is not creating an arch of the low back or a pulling forward of the pelvis. Again, I'm on forearms, but you could be down, and that might either make it less intense or more intense. And then again, you're going to bend your knee, and you're going to roll in and out. that you've released a little bit, if you can keep your knee bent, relatively neutral, you're going to see if you can do this kick up to the ceiling or to the sky. So now we're trying to get some hip extension without, again, getting lumbar extension. So as I do this, I'm only going so high that I'm not arching my back, right? I could go a lot higher, but that's coming from my lumbar spine versus keeping that lumbar spine still and moving from the hip. And then release. And we'll do the same thing on the other side. So again, I start with the ball on my top hip. I then roll onto it. I'm bending the opposite leg. And I sometimes have my toes tucked. I sometimes have my foot flat, whatever works for you. So again, kind of look around, search around. How does this feel? You can always use less air in the ball or more air in the ball. Because we're rolling over this more sensitive area with these sensitive structures deep, I would encourage you to use an air-filled ball versus a dense ball. Our body is always trying to protect, and so especially on sensitive structures, we want to not use hard things, which would maybe encourage the body to harden and protect more. Once you've kind of searched a little bit, see how it feels, bend and straighten, pin and stretch. To further pin and stretch, internally and externally rotate windshield wipers. Again, you can be down on your hands at any point. Just make this comfortable for your whole body. You are one whole body. You can look at all these individual parts, but we're one whole unit. And then to further pin and stretch, stay relatively neutral and see if you can extend the hip, kick the foot to the ceiling or the sky. You can always use a hand on the low back. See if you can determine where is your hip end range of motion versus lumbar. All right, this is a subtle difference. And then release. And that's all we're going to do for rolling. Now we're going to do a little bit of movement. And if you're on a really sticky yoga mat, you might prefer to be on something a little bit slicker. You're going to start on your back, kind of similar to where we did our assessment. We're going to again find our relatively neutral position. Now that we have a little bit more awareness of the pelvis, ASIS should be pointing directly up to the ceiling or the sky. Feel free to tuck and tilt to get your bearings, to know where you're at. That creates a little space of the low back. And then again, seeing if the ribs can kind of settle and drop down. You can leave your hands on your pelvis or out to your side, whatever works. And we're going to start first with an inhale, actively bringing the knee out to the side. Exhale, actively bringing the knee to center. So at no point are we passive here. Inhale, exhale. Actively opening, actively closing, and the whole time trying to remain as still in the pelvis so that we're truly, again, moving the thigh and the femur. From here, the next time you open your leg, keep it there. Slide the leg straight. It tends to then also internally rotate and adduct, and then bring it back to center, vertical. Inhale, exhale. Inhale for half, exhale for half. You'll start to find a nice flow with that. And your circle might be smaller, right? Your leg doesn't have to get totally straight. The most important thing is that you're moving your thigh independent of your pelvis and your lumbar spine. The psoas and the iliacus are primarily responsible for that. Switch directions. Inhale, straighten. Exhale, roll out and return to vertical. Use your hands where you need. Embody your body, and use this as a time to self-study. What can you learn about your body? One more this way, and then we'll do the same thing the other way. So we'll start with just the knee going out to the side, and then up. Inhale, knee out. Exhale, knee up. Not a knee drop, not passive, but active both directions. And there's some activity in the core to maintain stability of the pelvis, right? The weight of our leg is going to want to pull the pelvis off to the side. We're trying not to let that happen. When you're ready, the next time the knee goes out, inhale, exhale, slide it long, straighten it out, pull it in. Inhale, exhale. Take sips of inhales where you need. The exhale will help to encourage a little bit more abdominal engagement or stability. So whatever part of the movement is harder, use your exhale. Breath is key. Without breath, we aren't living. And then switch directions. Inhale, straighten. Exhale, slide it out and up. Use your awareness, self-study. How smooth can this feel? How articulate can you allow your hip to feel? So what we're doing here is really articulating the hip and its ball and socket joint. And we each have a different history, so if anything's catching, clicking, or uncomfortable, listen to it. Take a moment to pause and breathe. And then from here, reassess what you did at the beginning. So if you did a different position, check in with that. If you started here, check in first of all, how are you just simply laying? How are you resting? And maybe again, there's a need to release out since we just did some activation. So first, passively, how is your skeleton, pelvis, lumbar spine, and rib cage just simply resting? How much space do you feel at the front of your hips between ASIS and femur? And then if you straighten your leg, what does that feel like? Does it pull the whole lumbar spine, or does it pull the pelvis forward? And switching sides. Nice work. Take your time to do anything further or just to assess. And part 2 is coming up next.